All right, so my name is Dimitri Villanueva, and today I want to talk to you a little bit about testosterone replacement therapy, or TRT for short. Testosterone replacement therapy is essentially the use of exogenous forms of testosterone hormone in order to better optimize your hormone levels in a person who either is suffering from inefficient hypothalamic or pituitary disorders, or most often people who are in the fitness industry who are trying to gain certain type of results that couldn't be done naturally. So first I want to start with somebody by the name of Dr. Jeffrey Life. Some of you may have seen these photos before. At age 67, he was unhappy with the way he looked and wanted to do something about it. He was into fitness, into working out, but he couldn't quite get the results he used to get when he was younger. So he had his urologist put him on testosterone replacement therapy. And this was the results that he got from it. And from there, he actually went on to release a book called The Life Plan Diet, which in addition to diet and fitness, also advocated for the use of hormone therapy. Now, I'm sorry? Oh, yeah, probably. Yeah, no, he probably went for the lighting and the editing and everything. But one of the key things that he talked about was he wanted to, what he called, square the quality of life. Where he said after age 40, we begin to see this decline in health, where it just continues to trend down until we die. He wanted to find a way to kind of square that out and improve the quality of life from age 40 onwards, which he believed he was the best example of what can happen with the therapy this way. So how did we get to this? Well, the origins of TRT kind of start back in ancient Chinese culture, where they always believed the consumption of various animal parts would result in this vitality or enhancement in whatever male dominant traits that they found desirable, aggression, their libido, things like that. It was believed to have first been recorded in a book called The Classical Fundamental Prescriptions of Universal Benefits in 1253. However, in 1849, it was when Dr. Arnold Berthold was able to surgically re-implant castrated chickens with the male gonads and observe the results that upon reinserting these gonads into the chickens, they resumed their normal male functions. They were more aggressive. They fought amongst themselves. They had more inclination towards the female hens. So this was kind of the beginning of it. Dr. Brown-Séquard actually took it a step further and took the serum from the gonads and injected it into himself. And he believed that it was leading to, he claimed that it gave him vitality and all of these benefits. However, it was more placebo effect than reality. It wasn't until in the 1930s when Loewy and Voss first demonstrated the biological activity from testicular extracts, which a year later led to Dr. Boutinot laying the groundwork for modern androgen therapy, when he was able to obtain the testosterone in the crystalline form from bull testes and chemically synthesize the testosterone. Now, there was a problem with this. Even though it was immediately used for therapeutic purposes, testosterone in its natural form will quickly disintegrate or dissolve once into the body. I think it was about 3 or 4 days that it would last. And they needed to find a way to make it last longer. And the answer that they came with was a form of testosterone esters. It was longer lasting and had a slower breakdown, which we'll get into in just a second. Now, here in the production of testosterone, very simplified form, testosterone first begins with cholesterol and undergoes one of the two pathways, which will go from progesterone to androstenedione. An additional pathway can be DHEA. But as I said, in this natural form, it will quickly break down. So what they had to do was create testosterone esters, which two of the most commonly prescribed versions of it for injecting is cypionate and ethionate. And when testosterone undergoes esterification, it's done to improve the solubility of the testosterone in oil. What this will do is slow the release and give you more of a 10-day period in between dosages, so the person can have a more smoother administration of the hormone versus getting it all at once and having these crazy fluctuations. So the hypothalamic pituitary gonadal axis, or the HPGA, is how this is regulated. The hypothalamus first secretes what's known as gonadotropin releasing hormone, which then acts on the anterior pituitary to release follicular stimulating hormone and luteinizing hormone, which then acts on the male gonads to produce testosterone. Now this has negative feedback loops to the anterior pituitary and hypothalamus to help regulate the amount of releasing hormones once there's been an optimal level of testosterone. However, when certain disorders occur, this can cause a lot of problems, as we'll see. In primary hypogonadism, this is when you have an above average levels of stimulating hormone and luteinizing hormone from the anterior pituitary, and this is because the male gonads aren't producing enough testosterone, so as a result, the body isn't sending back the negative feedback loops, so it assumes that it's still deficient. So you get this overproduction of these hormones. The other one is going to be secondary hypogonadism, which is a result in either the hypothalamus or the anterior pituitary. It can either be a tumor in the hypothalamus or just a deficiency in the anterior pituitary. And you're going to actually see lowered releasing or gonadotropin releasing hormone, luteinizing hormone, or follicular stimulating hormone. This, of course, will prevent the production of testosterone in general. And then finally, you have mixed hypogonadism, which you're going to see is kind of a blend of both. And this is most commonly seen in aging men. As we get older, we tend to produce less testosterone as well as other hormones in the body. And this is kind of the market that testosterone therapy has begun to go after and is now almost a $2 billion industry, which I think is primarily because of the baby boomers. So as we can see here, the age-related decline in testosterone levels tends to begin right around 30 years of age, or after 30 years of age. And what you see is, in the red, sex hormone binding globulin is a protein that binds to testosterone in the bloodstream and basically renders it unavailable for use. It's no longer bioavailable. So as we age, we end up producing more of this SHBG, and as a result, we see this slow decline. Now, notice at age 70, we tend to kind of plateau on the production of this hormone, and you actually see a slight increase in testosterone production. However, as you continue to age, it will still decline. So the common symptoms of hypogonadism can range from cognitive issues, such as difficulty focusing, moodiness, depression, insomnia can be another one. People that have a lot of high anxiety sometimes can stem from issues relating to a decrease in optimal hormone production. As far as the heart, you can have arteriosclerosis. There's a lot of talk about people who have too much testosterone in their body. People who abuse steroids can damage the heart. Well, the same can happen as if there's an underproduction. As far as muscle and fat, gaining fat is a typical issue, as well as trouble gaining muscle. People that have low levels of testosterone might have higher levels of estrogen, which can lead to development of gynecomastia or male breast tissue. And then, of course, loss of libido, decreased sex drive, testicular atrophy, decreased sperm count, and infertility are some of the issues with that, as well as erectile dysfunction. An interesting thing to note is that prior to endocrinologists using it as a form of therapy, urologists were actually more commonly using it in order to treat erectile dysfunction in patients. This is before Viagra was on the market. So what are the treatment options? Well, there's a variety of different options available. One of the first ones your doctor may recommend will be the natural method. You know, he's going to want to see, especially if somebody's out of shape and doesn't really exercise, they're going to want to see what putting somebody on a diet, exercising, and supplementing with things like zinc or vitamin D, which have shown to naturally increase testosterone levels, are going to do for the patient. This is especially if they're kind of bordering on the verge of being diagnosed as suffering from hypogonadism. You tend to want to be right around above 400 nanograms per deciliter and below 900 nanograms per deciliter. So somebody that's right on the border, they're going to want to do the natural option. If they feel like they need some form of therapy, there's two things there's a gel and a patch. These are going to be the least invasive. Trouble is with the patches or with the gels, you can't come in contact with anybody for 4 hours. So if somebody has a wife and kids and they put it on in the morning, they can't really come in contact with anybody, and it's a little bit of a pain. Patches, kind of a little better option. However, if they get wet, it can lead to irregular dosing, which can cause its own problems. If you try taking testosterone orally, it's been known to cause issues with the liver. There is a company that is working on fixing this problem, which I'll get into in the last slide, where that's kind of one of the main reasons a lot of physicians recommend against that option. And then we have pellets, which is more invasive, where you surgically implant in the lower back area testosterone pellets that will sit there for about 6 months and slowly dissolve. The problem with this is if they get the dosage wrong, they have to go back in there and either remove or add more. So that can be very uncomfortable for the patient. And then finally, you have the injections, where out of all of them has the best absorption rate of all methods. It's the most bioavailable in the body. However, if you're needle phobic, you're not going to want to be getting these every week or 2 or 3 weeks. As far as the ideal dosage, this is something that's still a bit controversial. You can see testosterone ethanoate at 250 milligrams administered every 3 weeks is going to lead to these wild swings in your hormone levels. You're going to have this huge jump to 1200, followed by this drop all the way to below about 300 nanograms per deciliter every 3 weeks. And this is not something you want to have with a patient, because you're going to end up having all of the issues that they've already been having to begin with. The moodiness fluctuations, or you have like the development of acne and issues like that. So on the right side, you see testosterone ethanoate at every 2 weeks, and you kind of still have a little initial jump to the 1200, but as you can see, the curve is a little bit smoother as it goes towards week 14. They're not dropping below clinically normal levels, and it's something that's more recommended for patients. So like I said, some of the emerging therapies, Tesserex Pharmaceuticals is a company that's coming out with a more oral available version of TRT that is less harmful to the liver, and is currently undergoing phase 2 trials with some success. And one of the cool things, one of the side notes on this is it's co-founded by Western U's former GCBS Associate Dean, Dr. Guru Bedagiri. I thought that was pretty cool. And so how can I get tested? Well, there's a variety of different ways you can do it. One of them is just asking your physician, can you get the blood work? I've been feeling this certain way. I want to see if my levels are low. However, some issues that a lot of people encounter is if they feel you're too young to have those kinds of problems, they may deny you the authorization to get the test, or your insurance might not even cover it. So this can be a frustrating thing for a lot of patients. So some patients have tried going elsewhere and purchasing either online, and there's a variety of companies. However, I'm more partial to this one. I think it's pretty good. And it's a lot easier to just buy it online. You don't have to deal with the physician, and you can get your results in a week. So thank you for your time. Questions? Steve. From what I read, it's just a naturally occurring process that happens as you age. There's still not sure. One theory I saw was it's like the body's natural way of kind of like slowing down the metabolism as we age. I know Dr. Aqua mentioned that the metabolism does begin to slow as you get older, and that may play a role in it, but I didn't find anything that was definite on that. Yes?
I don't know if you mentioned it, but if cholesterol is a precursor to
That's one thing that, again, is a big reason why they want to keep you within certain ranges, because if you do go beyond a certain level of hormones, you can possibly have an excess of cholesterol buildup or lipids. This is why people end up having heart attack issues. Although a lot of it was also the unnatural thickening of the heart, which is something you don't want that you can get from doing this. That's a lot also with more like growth hormone. But yeah, testosterone and cholesterol do kind of go hand in hand. So when you do increase that, you might have to keep an eye on that as well. Especially if someone has a history of high cholesterol in the family, they may not be a candidate for this because they're going to be at risk for a heart attack. Alex.
What are the side effects of TRT and potentially unwanted?
So like I said, the side effects of TRT, if improperly managed, are going to be your garden variety side effects you hear in the media all the time, and somebody ends up dying from them. You know, like you said, the heart attack, the acne, sometimes balding at an early age is an issue. You have kind of like roid rage, which is something that's still debated whether or not that's a direct effect or if that's just something that the person has regardless of it. Now, it might be because of the moodiness that's associated with it. You might have more aggression as a result of it. So that's kind of the basic side effects that you see with that. That can, for the most part, be mitigated if properly managed by a physician. Emerald. Yeah, that's the problem. That's the problem. You try to put it on, and then let's say you want to hold your kid in the morning or your wife or something, you're giving them an excess dose of testosterone that they don't need. And there's been a lot of times where patients report, you know, the women either growing hair or having more aggression, issues that they, you know, weren't expecting to have, and it's as a result of that. So it's the sad thing is it's one of the most covered forms of TRT by insurance companies, so that's why it tends to be given. But it's not one of the most favorable ones by the patients. Yes. On the shoulder. Shoulder area or underarms. There's some that have, it almost looks like a deodorant stick, and it's applied in the underarms. No. No, I haven't. Not yet. I'm still too young for it. So my... No, so one of the things is a side product of testosterone is DHT, and what DHT will actually do is bind to the hair follicle and destroy it. So there's drugs on the market called finasteride, which will inhibit the production of DHT. However, a side effect of that is you're also not going to be making testosterone. So a lot of men complain because it affects their libido, even though they're growing their hair back. So again, it's a delicate balance. Yeah. Mm-hmm.
Taking TRT does not also reduce the size of the
it's one of those things where if your body is already underproducing, it's not much of a concern for physicians because the atrophy of the testicles in a normal person, yes, would decrease testosterone. However, somebody that's already suffering from a deficiency isn't going to cause much of an issue because they're already deficient to begin with. Now, that is something that a lot of people think, oh, I'm just going to get on TRT to, you know, gain more muscle. And TRT is something that's for life. This isn't something you kind of get on and then get back off. Like, it's something that you're taking because your body is failing to produce it. And it's something that needs to be seriously considered beforehand. So what happens when you stop taking it? You're going to have a giant fluctuation in your estrogen level. So they usually want to put you on something called PCT, or post-cycle therapy. And that's going to be something that's going to be like an aromatase inhibitor, which will help prevent the excess production of estrogen. That's something that's also given to women who are at risk for breast cancer because, as you know, the excess production of of estrogen can lead to breast cancer. So it's kind of like once you minimize the amount of testosterone being produced, it takes a little bit longer for the estrogen to catch up and normalize with the body. So they have to kind of manage the other hormones that are thrown a little bit out of whack as a result of being taken off the therapy.
Is there any gene therapy
Gene therapy. No, that's not something I came across. This is more just what's currently being just done now. But that'd be an interesting way to kind of go about it. Like I said, this is something that naturally can happen. There are people that are born with deficiencies and disorders, but the market is focused for people that are 40 and beyond, and it's just a natural process of life.